So Mitt Romney is in Israel. And not only does he say that there's a cultural problem with the Palestinians that keeps them from having such a good GDP, but he also said this: our health care costs are completely out of control, speaking of the Americans. And you know what? I mean, I guess this is the time where people say, hey, whoa, I thought you were the no apology guy. Why are you going over to Israel and dissing our health care? We're number one. He goes on to say, do you realize what healthcare spending is as a percentage of GDP in Israel? 8%. You spend 8% of GDP on healthcare. And you're a pretty healthy nation. We spend 18% of our GDP on healthcare. 10 percentage points more. I'll tell you, for a guy who thinks that Israelis have a cultural advantage when it comes to making money, doesn't seem to know that they know how to add and subtract. That gap, that 10% cost, let me compare that with the size of our military. Our military budget is 4%. Our gap with Israel is 10 points of GDP. We have to find ways not just to provide health care to more people, but to find ways to finally manage our health care costs. Israel has a national health insurance law. Every Israeli citizen is entitled to health care services. Every resident has a right to register as a member of an HMO of his choice, free of any preconditions or limitations stemming from his age or the state of his health. In other words, no preconditions, rejections, assured access. Every resident has the right to receive all the services, including in the medical services basket. This is all government mandated. Oh, and you also have a mandate to buy insurance. Every member has a right to receive the health services while preserving the member's dignity and privacy of medical confidentiality. Each member has the right to select service providers. Each member has a right to know which hospitals and institutes and other service providers are included in the agreement. Each member has a right to receive a copy of the HMO regulations. They have a right to file suit at the district labor court. On and on and on. There are price controls, government-mandated price controls. We should be so lucky to have their health insurance program. So I guess for Romney, you either got to live in Massachusetts to get those type of mandates, or you have to be culturally ready to accept them. Unbelievable. Unbelievable.